Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are talking to Lisa Dolan, who is the Senior Vice President and Chief Nursing Officer at Ardent Health Services, about upcoming trends and challenges in nursing in 2024. So, hi, Lisa, how are you?
I'm fine, thank you.
Good. Thank you for being here. So let's jump right into it. What do you predict will be the top five biggest challenges in nursing in 2024?
Well, of course, at the top of the list is just supply of nurses. So the demand's far outpacing the supply. So that'll be a key piece. Second to that is stabilization of support roles. So as nursing becomes more and more taxed, it's especially important that we have a support team around the nurse.
Mhm.
And so we're finding it more and more difficult to be competitive in our staffing of support roles. So that's a key worry and concern as well.
Mhm.
Um, I think another key piece is innovation, and there's so much great innovation going on, but how we incorporate that so that it's helpful to the nurse and not adding additional burden to the nurse
Mhm.
is especially important. Frontline nursing leaders and being able to retain the nursing leader. That's a very difficult position. In fact, I always say it's one of the toughest positions in the hospital.
Mhm.
So, being able to retain and support those frontline leaders will be key. And then, last but not least, is really just burnout in general of the
Mhm.
clinical staff. And the roles are so difficult at times. And so, being able to have a healthy work environment for people to feel comfortable and not experience the rate of burnout that they have over the past several years.
Absolutely. So, what can CNOs do to help mitigate those challenges?
Well, probably one of the biggest things is just to create efforts that kind of re energize their communities
Mhm.
and their markets around nursing and healthcare careers in general. I think COVID initially painted healthcare workers in a positive light, but then
Mhm.
it also, on the heels of COVID, we had a lot of people think, gosh, I really don't know that I'd want to do that for a living. So,
Mhm.
really trying to help re energize the public about healthcare careers and how fulfilling they can be is a key piece and a key role for the CNOs going forward in their communities. Um,
Absolutely. Yeah.
mhm. Additionally, I think really creative partnerships with academic settings to help produce more healthcare workers. We've got healthcare settings that need support, need staff, but then the academic settings also need help and are
Mhm.
short staffed. And so, if we can be creative in our partnership efforts with those academic settings to help augment their staffing and of clinical instructors and allow them to take additional students, would all be very helpful as well.
Absolutely. Those are interesting
Mhm.
insights. So, what do you foresee being the next technological trend in nursing, and how can technology aid CNOs in their teams?
Yeah, there's several that I wanted to make sure that I mentioned. I
Mhm.
think virtual care and virtual care platforms is key for our future. Virtual care, if you in nursing, can
Mhm.
assist with data collection. We can help admit patients, discharge patients, do patient education, family education. So there's many things that a virtual nurse can assist a bedside nurse to complete and do, and actually feel like they have more time to spend with the patient.
Mhm.
So that's a key piece. Additionally, I think virtual provider support, and what I mean by that is bringing specialists to the bedside,
Mhm.
and that might be a specialist in nursing
Mhm.
to offer support to maybe a newer nurse, or it could be a certain specialist physician to see a patient, and it allows where those resources might be scarce, it can help bring that provider or that specialist to the bedside much quicker. So
Hmm.
that whole virtual platform is going to be uh, a huge benefit to nursing, I think, and bedside care in general. One of the other pieces that's pretty significant are wearable technologies to
Mm-hmm.
monitor vital signs and monitor the patient's status. So that is just going to open up. It allows more continuous monitoring of vital signs.
Hmm.
It frees the staff so they don't actually have to do the task of taking vital signs, but can spend time with their patients doing other things. And then we have just that continuous and reliable monitoring that can then feed into systems that takes me to AI
Hmm.
and the AI in the future of taking that information and that data and helping to support the clinician to make decisions and can even add alerts and pick up things quicker to aid the team at the bedside. So lots of technologies. I think, there's also the whole notion of smart rooms and
Mm.
creating smart room technology that allows you to monitor patient movement within the patient room.
Hmm.
So you can look for things like patients who are at risk to fall that might be
Interesting.
getting out of bed, or is a patient turning as often as they should, and then driving alerts to the team to help with an intervention if needed. And one really exciting piece is the smart room that can hear and listen. So the opportunity might be there for transcription. So I
Mm.
do documentation just by talking through the room and having that assist with my documentation. Or if I'm in a potential safety situation, then I could say keywords or call for assistance and be able to get help if I needed it in the room.
Absolutely. I can imagine that would really help with preventing a lot of workplace violence incidents from
Mhm.
escalating too much.
Sure.
Yeah. So, what do you think the wider impact of remote patient monitoring and virtual nursing will be across health systems in general?
Yeah, I think what we're going to see is we're going to see significant impact to certain outcomes.
Hmm.
I would anticipate that virtual care um, is going to be able to help us manage our length of stay for
Hmm.
patients. So it'll eliminate some delays possibly in a specialist coming to the bedside. Um, we will see, I think we'll be able to pick up on patient deterioration much quicker
Hmm.
if we've got continuous vital sign monitoring. Um, there's also, I think, just that whole assistance that it provides, I believe, will help retain nurses because it's going to free their time from doing tasks
Hmm.
that maybe they can use that time to spend with the patient at the bedside with emotional support, actually caring and compassionate activities with a patient, which is going to be very fulfilling for the nurse. That's typically why nurses go into the career.
Hmm.
And so then it frees them up from being so task focused and allowing them to really take care of activities that are much more fulfilling and providing the patient support.
Absolutely. Yeah. So, how can CNOs help their staff avoid burnout and maintain a healthier work life balance?
Gosh, there's a lot that can be done. And I think one of the initial things is just to be open and talk about burnout
Hmm.
and recognize that it's a real situation.
Hmm.
And so we can do things like, you know, having well-being check-ins. So if debriefings after a serious patient event,
Hmm.
we can do things creatively to help our staff adjust with key life events maybe offer support programs that are geared toward new moms or people who are taking care of aging parents.
Hmm.
And then I think the thing that we forget so often is just to recognize people and celebrate wins. So
Hmm.
if we have great outcomes, let's celebrate every opportunity we have and then make sure that we harvest, especially patient feedback, to recognize our nurses anytime we can.
Absolutely. So, are there any other trends that you're seeing that you think will continue into the new year?
I think we're going to see continued emphasis on quality and safety
Hmm.
measures. That whole focus of pay for performance and meeting all of those key metrics is going to continue to be really important.
Hmm.
Um, I think we're going to see a transition. I know at Ardent we will see a transition from a focus on patient experience in the hospital to almost a consumer experience across the care continuum. So, what is the experience for our patients when they interact with the system? And
Hmm.
so that might be, making appointments. It may be their experience when they access their information through their Epic chart. Those are all key things. I think the other piece that we'll see a lot of is um, different pilots on care delivery models. So,
Hmm.
because we know we don't have enough nurses
Hmm.
to maybe support historic approaches, we'll see people do different team approaches to care. And so, that whole ability for people to work as a collaborative group and come together and care for a patient, I think is going to be key into the future over the next year.
Very interesting stuff. Well, thank you so much, Lisa, for your time. I'm really, really grateful to have had this opportunity to hear your insights, and thank you to our audience members for listening.